So, welcome everybody. Thank you so much for hanging in there while we face some of the technical difficulties. I am Deepthi Harkar, Chief Operations Officer here at Nutri Health Foundation. I joined Nutri Health recently. If you have been following us, Nutri Health on social media, you would have seen this post that came a couple months back that talked about me joining the organization and all the exciting things that we are going to do. And this is one of the most exciting things that we have. We are going to start very, very soon. And I welcome you all for this interactive session with Esther and Vanessa. Thank you so much for registering and having your time for us today. I am a registered dietitian by profession, and I'm very, very passionate about empowering co-nutritionists and also contributing towards the field of nutrition. In the process, we have come up with a very exciting course on oncology nutrition. So we are going to talk to Esther and Vanessa today about that. And I am going to ask both of them to introduce themselves really quick so we can jump into our questions. So I'll let, I see Vanessa on my screen right now, so I'm going to go ahead and ask you to introduce yourself and give us a brief overview of what you do, Vanessa, and then we'll go to Esther.
Well, I am a physician, nutritionist. I'm both a registered dietitian and a doctor. Yeah. And I have a PhD in clinical nutrition. So we do also some research, but my focus for many, many years, like more than 20, has been oncology nutrition.
Oh.
I work both in a public hospital in Mexico City, in which I started a big nutrition support service. And obviously that service started in the oncology building with the oncology and hematology patients, and then it expanded to the rest of the specialties in the hospital. And I also work in private practice in 2 or 3 hospitals here in Mexico City, focused in oncology nutrition. So we've taught many classes around in postgraduate studies for physicians and for dietitians, focusing in clinical nutrition, but mainly in oncology nutrition. And that is why I think it is so important for dietitians to learn more about oncology nutrition.
Yeah, that's wonderful. Wow, you're a busy lady, Vanessa. Hearing what you do. Esther.
Yes. Okay, so I'm Dr. Esther. I am a PhD in nutrition. I'm also a registered dietitian from the Indian Dietetic Association. I don't have that much experience as Vanessa in oncology, but around 8 years now in oncology field, prior to which I was more focused on gastroenterology. 8 years has been a learning experience for me, dealing with cancer patients and trying to understand their challenges and devise the diet plans that will work for them, integrate with different departments. So it has been a very enriching and deep learning exercise for me. And with that background is where we are looking at training upcoming dietitians through this course. So that's a brief introduction about me.
Awesome. Thank you. I have known Esther for a long time now. I have been inspired by her, like many of other people that she mentored. Yeah, she's been very thorough from when I have known. So yeah, it's an honor to have you here, Esther, and you as well, Vanessa. So I'm gonna directly jump into the questions and